I wanted to start out with this one. Why are we all so tired? When people come in to see me, it's the most common topic that comes up in the appointments. So, I mean, I see it in everyday life. I see it on the road. You know, we see it involving different things that are occurring in our community. So, is it just that we're tired, or is there something else going on? And in particular, is there something else going on for each individual? I won't say that every cause of fatigue and malaise is the same. In fact, it can be very different for individuals. So I invite you in terms of thinking of other people or in just assessing what's going on, you know, to ask yourself, is there something else going on that is contributing to these symptoms? We are going to be talking about adrenals and thyroid, very commonly associated with fatigue. But what's also true is aspects of brain health and in fact hormones play a big role. I have many patients who, you know, that I put on bioidentical hormone therapy, and they report an improvement in energy, specifically when we're talking about those that are for that purpose, let's say DHEA, testosterone, or that help in those ways. So what's also interesting in terms of hormones and thyroid and adrenals is that a deficiency in one area can contribute to a problem in another. So let's say you feel like your thyroid is adequately balanced. However, and I see this happen often, is what can happen is if you overly, you know, focus on thyroid, you can actually drive your adrenals into exhaustion. So when you treat, if you're not working with a doctor that's looking at both, you're not really getting the optimum approach that you need. It doesn't mean that's true, but it's often the case because they depend on each other. I often refer to them as being yoked together. They're a system, and they're part of the same system. So how do you begin to assess what's going on in any one of these areas? And this is where I say start to do your own track down if things are related to you in general, or let's say a significant other or a friend, or, you know, it can begin anywhere. But what are the symptoms that you're reporting? And don't be shy about saying something. I often will encourage a patient during a consult, well, is there anything more, hopefully before we get to the end of the consult. And yes, they'll say, by the way, this. And sometimes people will be a little embarrassed to say it, or I don't think it's much. And sometimes what happens is it's really the bottom of an, you know, the tip of an iceberg. It's really a big issue. And that's not always a doctor's favorite thing, is you're going out the door to bring up a really big topic. It can be awkward to getting things done, but at least it begins to open up the discussion. So I would say maybe in terms of brain health, other things, have others noticed a problem? You know, I do a lot with hearing loss and aldosterone therapy, and sometimes it isn't the individual that knows they have a problem, it's somebody else that notices it. So have others mentioned something? Do you notice a change, let's say, in how you look, how you feel, how you interact with others? Are you becoming more angry? For example, I'll give you you know, we often talk about as people come in kind of noticing how they are. There's an expression sometimes you hear called the grumpy grandpa. What grumpy grandpa is usually, not always, but it's often a man that's low in testosterone. So sometimes low testosterone in men will manifest as anger or inability to cope. And I'm not saying always, and I'm not saying if you have a grumpy grandpa, that's why. I'm just kind of saying that that is a symptom sometimes we see. For example, are you losing the outer third of your eyebrows? Hair loss like that. I'm not speaking of hair loss, let's say, on the legs, but eyebrows can be low thyroid, for example. Are you having hot flashes and night sweats? Women particularly, but we will see it in men too. It will sometimes happen. Is it hard to wake up in the morning? Or are you having a slump in the afternoon? Differences there. So morning, probably thyroid. Afternoon, maybe adrenals. Do you have mood changes? Are you noticing that you're not coping well? Is your thinking affected? I had a patient the other day, and she was noticing, even though she felt okay, but she was having trouble thinking. So you will see brain fog, mood changes with every one of these things that we're talking about, from thyroid and adrenal function to hormones to brain health. So you will see these, and so they similar symptoms, different causes. How do you determine, in fact, where to start? And so I want to start with hormones because it's a big topic. But I want to say that everything I'm talking about tonight, everything, in fact, everything you've done from birth till now has been a program for brain health, everything. So, and what research is finding, and I'm going to allude to this research study a little bit later, it's called a reversal of cognitive decline, a novel therapeutic program. And I'll just tell you now that 9 out of 10 patients who are put on this program experienced an improvement in their brain health. But am I going to say that there's this nifty drug, or that it was because they exercised, 40 hours a week? Or I'm not going to tell you something like that. I'm going to say that, and in fact you have a handout there, that everything we're talking about is relevant to brain health. And that's what this particular study did with 10 people, 9 of whom improved. They implemented things that holistic medicine has been studying and identifying for years. So everything I'm going to talk going forward here is related to what we're going to end with, which is brain health. So hormones, how do they play in this particular scenario? They do. Now, I didn't write it here, but hormones are part of this particular picture. And then depending on how old you are at the time you start hormones, it may affect how they're given to you. So you may not realize this, but Dr. Wright is considered the father of modern bioidentical hormone therapy. He didn't invent hormones. He didn't invent the process of giving them. He did work with Cripps Pharmacy up in Vancouver, BC, and he did come up with a bioidentical approach to hormone therapy. And as the story goes, Dr. Wright will tell it himself this way. A woman came in, and Dr. Wright, and she wanted hormones, so he pulled out his prescription pad and started to write a prescription for Premarin. You may not know that Premarin, which was the common estrogen hormone that was given to women at the time, and the name means pregnant horse's urine, pregnant mare's urine, Premarin. And it's derived from horses. So she said, no, wait. I don't want horse's urine. I want something for me. So he had to sit back and think about that for a while. And so he worked with this particular pharmacist, and they came up with the first hormone, bioidentical hormone called Triest. It was derived from the Mexican yam. And it's not a patent medicine, meaning it's identical to our hormones, and we derive all of the relevant hormones from this, and it only needs one step to convert it from the yam to a product that you can use. So we have since gone away from using Triest so much for a number of reasons. We're using more Biest, and Biest, it means 2 estrogens. Triest means 3 estrogens. What I also like about Biest is also bioidentical. That's what I derive out of there too. So when we're talking bioidentical, we're also talking about not only is the molecule closest to your own, but it's also following nature. So for example, in women aren't really designed to have hormones given to them after menopause. But as we live longer, we age more effectively. And you can even see it if you look back at pictures of people in comparable age groups. You will see that people are aging better now. A lot of that has to do with different therapies that are available. But at the same time, some of these therapies are actually helping people to age better. And by the same token, then improve in other ways. So bioidentical, meaning we copy nature's intention, And for women, for example, that means we give them over the course of a certain number of days, and then we withhold hormone. In terms of men, men don't have a cycle per se, but we do also want to make sure that we don't suppress the natural testosterone production that a man might have, especially if he still wants to have children, have a family. So what are the benefits? And I did speak of some of the benefits earlier. Anti-aging. So this is commonly where people speak of anti-aging, although I would say supplementation, use of creams, all kinds of things, exercise programs are anti-aging. In many cases, especially for women, the improvement in the skin, the reduction of wrinkles, prevention of osteoporosis, and this is a big one. And a colleague was asking me about it recently. We absolutely see improvement in bone health, especially in women, using hormones and some of the bone health cofactors, things like boron, manganese, vitamin D, vitamin K. I have people that I have DEXA scans on, and I'm not talking young women. I'm speaking of women in the age group where they have fracture risk, and I do plan to write about some of these cases. I have actually had people improve in their bone health. Osteoporosis is also a problem for men, probably more so than it's been in a long time, because of things like proton pump inhibitors, things that reduce stomach acid. You need stomach acid to be able to absorb calcium to break down many different nutrients. So we see more osteoporosis also showing up in men as a result. But bioidentical hormone therapies, both estrogen and testosterone, are helpful in improving bone strength. The stroke and cardiovascular risk reduction, the reasons are that many of the hormones actually help support smooth muscle. They help improve vascular integrity. So that's how they can help improve in this area. It seems obvious, strength and endurance in both men and women. Yet I have talked to men in particular who didn't realize over time that their strength was actually diminishing. And so when we started talking about it and they realized that they were having a problem, then it became clear that adding in testosterone would be significant. Now, I don't just take patient report. I do testing as well. We see what the levels are. Obviously, reducing symptoms of menopause in women. There are many different symptoms from, let's say osteoporosis, poor sleep, hot flashes, night sweats. Hot flashes is a reference to vasomotor or heat, sudden heat surges during the day, night sweats during the night. It helps improve sleep for many people, progesterone in particular, and improving energy and mood. So a lot of good reason for using hormones. So, and this also kind of taking off on the previous, what symptoms would suggest, and this is again doing your list if you're interested in this. Do you have hot sweats, hot flashes, night sweats? Are you having trouble sleeping? Are there mood swings, depression? In particular in women, one sign of low hormones is also frequent urinary tract infections and incontinence. And part of the reason is that the hormone levels drop in the vaginal tissues, and so that increases let's say that there is a vaginal atrophy or dryness, which then allows bacteria to penetrate the urethra and the bladder more quickly. For men, reduced stamina and strength. Let's say you do work out, but you're not building muscle to the degree that you would like. Mood swings, like I mentioned, the grumpy grandpa, sort of more anger or even passivity I've seen. Low libido, that one seems pretty obvious, but it's not always to everybody. Having BPH or symptoms of poor urinary flow. Prostate, this is where the prostate comes in as well. So the prostate, I heard of, not sure if it was Dr. Wright or a colleague or at a continuing education seminar, that someone said basically the prostate is a very poor design in men. he said it's designed to actually grow your entire life. So it expands, and you have this tube going right through it. So what can happen except squeezing that tube, the urethra going right through? So poor design, and so it's not surprising that many men develop BPH and have difficulty. But testosterone can actually help in that circumstance. Now, I'm not going to say that's the only thing to do. There are different supplements to add in, different causes to look at. But it is an important factor. So how do you assess the need for hormones? How do you determine? So when people come in, I do take a very thorough history. I want to know what the symptoms are, when they started. With women, it's pretty clear, if we're talking menopause, it's the definition of menopause is you have not had a cycle for 1 full year. But it also is measuring FSH and LH and seeing that the numbers are too high for you to still have ovulation in the first place. But it's not always clear. I would say for every individual, every hormone therapy, it's totally unique what comes in and what people talk about and describe as a problem. Dr. Wright did actually develop a 24-hour urinary hormone profile, and we are in this section is the Meridian Valley Laboratory, and they actually are the laboratory that does look at these and many other types of tests as well. And so what we like about it, and over the years I've done this, looking at blood versus a 24-hour urine, I can see a clear advantage to assessing hormones with it. So 24-hour literally means you collect all urine for a full 24 hours. It's resulted out, and then we get values. And so it's the hormone pathway. Everything comes from cholesterol, by the way. So hormones, your endogenous levels are created from cholesterol, and then so we're all on steroids. That's the steroid hormone. And so essentially then, that whole pathway is what we look at and result out to see where your hormones are, where the deficiencies are. So it's far more effective at evaluating hormones than blood testing, which is one point in time. And the question is, what point in time is the right one? So is it for a young woman? I've heard various people say, it's day 3 or it's day 6. At what time of day? 2 o'clock? Midnight? So this will collect at a specific point in time all of the urine. So yes, you could say it's a collective, but it's phenomenally helpful in directing doctors like me in how to prescribe hormones. What's really nice too is it's collecting free levels. So when you're doing in the blood, let's say for testosterone, you're not getting free hormone, and the body can only use that which is free. In blood, testosterone, for example, is bound to sex hormone binding globulin, and the amount of that will determine how much is bioavailable to men. So, for example, we will get a testosterone free level in the urine, and that can tell me what your effective level of testosterone is. And then I get the urinary metabolites. I can see what the metabolites are doing, where they're going. So to me, looking at this is far more effective for men and women than looking at any blood testing. The blood testing, too, is really not only one point in time, but it's very affected by when you just use the hormones. And I've had a lot of people come in that have been given either way too much or way too little hormone based on just blood testing. And it's an interesting thing that happens with testosterone. And we've actually told not only men who are on testosterone, but people with thyroid, to, if you use it on the day of a blood test, let's say, you apply it and then do not have a test any sooner than 4 hours later. Many people get given prescriptions that are not appropriate because they applied at 1 hour, went in the next hour, and it looks gigantically high in the blood. That's a peak level. It's not your effective dose. The same thing happens with thyroid. If you take your thyroid, let's say at 7 in the morning, you go in and have a blood test at 8, it's going to get your peak level, not your effective dose. Now, I do believe in thyroid testing in the blood. It's far more effective in my mind. So basically, it says 24-hour urine is probably the best way to go. We're going to evaluate your health status. I'm going to ask you about health factors like risk of blood clotting, cancer in the family, prostate issues, risks of prostate cancer. And in men, we are definitely going to measure the PSA. PSA stands for prostate-specific antigen. Now, in some areas, it's been discredited as a test. We look at it, though, for the velocity of change, because you don't want to add hormone in if somebody has an active cancer anywhere in the body. So I want to cover kind of specifically, but I'll do this quickly, because we did mention hormones for women. Generally, there are 3 types of estrogen. You might see them listed as E1, E2, E3, estrone, estradiol, estriol. There are other forms. These are just the most common and the ones that end up in prescriptions. Progesterone is very important for women, especially if they have a uterus. If someone has had a hysterectomy, less so. But we believe in this clinic that we should give progesterone to women even when they don't have a uterus, because every cell in the body has a receptor for progesterone. And progesterone is, for some women, magic for sleep. I've seen women not be able to sleep. I give progesterone, and suddenly they are able to sleep again. Progesterone can often be given to men, too. I've done it very little, but it is indicated. Pregnenolone is probably the newest hormone on the block. It does help with word retrieval, and anyone in menopause probably knows what I'm talking about. The word doesn't come like, I think I can see it, but I don't know what that is. So that helps in that particular situation. We don't handle androgens very well, but not as well as men, and in much smaller doses. So DHEA and testosterone are very helpful. And growth hormone, I'll just clarify, growth hormone is really one of the longevity hormones. It's really important, but again, the FDA has made it really hard for some types of practitioners to give it. So for hormones for men, I think it's very important for men. It does help with mood, with mental health, with muscle strength, bone health, as I mentioned. Because testosterone does actually work a lot of a focus on muscle mass, it's really good for cardiovascular health. As I said, it's harder to detect the reasons in men, but that's why we do the interview, we talk about what's going on, and then we test. And if it comes back, testosterone is low, then I usually will do a therapeutic trial with it and see what then, after testing, what comes back after that. It's important, though, that the PSA not increase, that there isn't any reason to suspect cancer, that nothing gets worse. Sometimes slow wound healing will also indicate a need for testosterone. And I use testosterone a lot for women in terms of, let's say, improving vaginal atrophy. So a typical dose of testosterone for men, 25 to 100 milligrams per day. I am telling you about the way I use it, and topically. I get very worried in some cases about pellets and injections, because I've had people come in and they are reporting levels that are sky high. So you think, okay, it's going to dissipate, but sometimes it doesn't in those circumstances. I always add in some degree of DHEA because it's a precursor, and so it also is a good adrenal support, and men have both in high amounts, testosterone and DHEA. And as I said, the other ones to add in as well. I'm going to say that it's a safer approach to some of the conventional strategies, the bioidentical hormone therapy. But that's based on studies. I didn't include any reference to a study here, but there are studies that show this. A follow-up is needed. I mentioned the different types of follow-up that are important. And then I believe absolutely in annual testing and seeing your doctor just to make sure nothing changed. So I want to switch topics here for a minute. where do you start? Is it the thyroid or is it the adrenals? And I have to say, maybe it's just because I'm in this building and this is what I see all day long. I feel like we almost have an epidemic related to low thyroid, especially in menopausal women. But I think adrenal fatigue is really an underappreciated problem that many people are having. How do we test? So the question would be, you come in, you have symptoms, you're tired, and you're more tired than maybe you've ever been in your life. So we would have you do blood testing for thyroid. And I have people do with a 24-hour urinary hormone test because it's really the most effective way to see cortisone and cortisol levels. I don't particularly like a spot blood testing for cortisol. And then one that I didn't put in this particular part, if you really feel your adrenals are off, a 4-point cortisol is useful in saliva, and I may refer to it later on. But what that is you take a saliva sample at 8 a.m., noon, 4 p.m., and 8 p.m. You can do other combinations as well, but those are typical. So a typical curve related to cortisol, and that's what we're talking about when we're talking about adrenals. What wakes us up in the morning at 8 a.m. or sooner is the rise in cortisol. And then it starts to fall naturally throughout the day to where it's almost at its lowest ebb, not quite at its lowest ebb at the end of the day, that then propels us to sleep. The lowest ebb, the most dangerous time to be on the road, is at 3 a.m. So if you can avoid driving at 3 a.m., have you ever wondered, like, no one's on the road and there's an accident in the middle of the night? It's because the cortisol is low and you're supposed to be sleeping. Also, that rise in cortisol, that often has been attributed to heart attacks Monday morning as the cortisol comes up. So, but I have seen weird presentations where the cortisol is high at 8 a.m. and at night, and that's almost always, in my estimation from what I've seen, insomnia. So when it's very high at those times, then oftentimes people can't get to sleep. So this is where giving an accurate picture to your doctor, kind of assessing what's going on, is important. So how do you optimize it? And I would say the adrenals, as I said earlier, the adrenals are what you optimize first. But good thyroid function requires a certain amount of cortisol. So you want to look at both of these. And so if the adrenals are not functioning properly, that affects then the thyroid values. And I would say there's no quick way to do either one of these. In the best case, or let's say if you had this available, the best way to treat the adrenals is actually to take a 3-month vacation. So I can't give that prescription to many people, but it generally takes about 3 months for the adrenals to come back. Everyone's laughing, but it really takes a while for the adrenals to improve. It's an all or nothing sort of a gland. We can go, and that's what our society tends to have us do, and you go, and then you get to the edge of the cliff and you drop. I see people do that all the time. So when you hear people talk about crashes, they're off the cliff, and that's an adrenal crash. And so you've got to catch it before then. Many professionals, we don't. We go and go and go, and we miss the cues. And it doesn't help that we can leave the lights on all night, and we don't get the normal cues about going to sleep and resting. But the adrenal is the original I need to rest gland. It really is. Thyroid is a little bit more forgiving, and we have a bit more specific therapies for it. It generally takes about 6 weeks, though, for the thyroid to come up to level, and then I don't test any more often than every 3 months. So which is it? And this I'll ask you if you have a question, and let's say it's been ambiguous on testing, or your doctor doesn't even look at it. So both adrenal and thyroid, you gain weight, but in different ways, depending on how severe the problem is. There's a puffiness to thyroid. There are some classic pictures, if you look at them, the before and after. So before giving somebody thyroid, they look a certain way after it. They often look like they lost weight. The face just slims, the body slims. And when I talk to people, I ask them, do you have edema around the ankles, puffiness anywhere in the hands? I'll often see that as an issue. You'll see coarse, dry hair in people with thyroid issues. Nail issues will come up all the time. Poor healing. And many people that are low thyroid will actually be sick all the time. So infections are very common. Similar when you look at the adrenal, so you can see how you probably, can't tell the difference. I speak of an adrenal type in some cases, people who are chronically low. Oftentimes they have very low blood pressure, they're very thin, and in terms of using aldosterone, it's been most effective in treating people with low adrenals. And it makes sense because aldosterone is actually an adrenal hormone. So it's not universal. I really wish it was, but it isn't universal. So again, more about is it adrenal or thyroid. And I love this rule of thumb because it's so clear when I'm asking patients. So ask yourself now, when you exercise, does it make you feel good? Are you motivated? If exercise makes you feel worse, then you have an adrenal issue. Then you need to support your adrenals. If thyroid, however, exercise makes you feel good. Even with a low thyroid, you can exercise and do an exercise program. But most people with adrenals, if I say, can you exercise, the answer is no. Sometimes I can't even get out of bed. So adrenal is more dramatic. Thyroid, again, probably less so. So Hans, and I won't go into this a lot, he came up with the 3 stages of adrenal compromise. And he said initially, in terms of the alarm reaction, the fight or flight is, how do I want to say it? Fight or flight is really our reaction. Let's say we're running away from a bear in the woods. So we hope we never encounter one. But that's what happens with the alarm reaction. Every adrenaline kicks in, we run away. That's a normal response. But in our society today, we're running away from bears in the form of people driving, all things that are out there, even the stresses in our businesses, our lives, our family. We're always under stress. Now you need stress, you need positive stress even to live. But over time it affects the immune system, it affects how you function. So what we see in terms of testing, we will see the cortisol levels go up and we'll see other things go down. As the body then adapts to the stressors, we are all adapted to some degree to stressors, we start to see the numbers decline, but they still look good on testing. So then, stage 3, exhaustion. This is when the numbers plummet. We start to see very low numbers on testing. And then other things occur. We see poor wound healing. I see poor ability to cope. And I'll give you an example of what an adrenal response is, somebody that's adrenally compromised. And I had one patient tell me, birds singing really bother me. He couldn't stand the sound of birds. Even a child's voice that normally they might find pleasant in the other room was like, oh, I can't stand to hear that. Or neighbors. And I'm convinced some fights between people erupt because of adrenal stress. They just can't stand what that person is doing. Under balanced circumstances, they might not react that way. Even road rage, examples of people really out of balance in terms of adrenal function. So you will see these types of things occurring, and you will see some of these results that are occurring as well. I'm not saying chronic fatigue causes mercury toxicity, but it's already there and is being exacerbated by the state of adrenal dysfunction. There are a lot of ways to do it, so I'm not going to say there's only one. I use adrenal glandulars a lot, bovine types, that help support the adrenal cortex itself. I want to caution people about licorice. Licorice is definitely an adrenal support, but you have to make sure you have a lot more cortisone, which is the storage hormone for the adrenals, than cortisol. If not, what happens is you block the conversion of cortisol to the storage hormone, and that can lead you to further exhaustion. So you want to use licorice carefully. It's definitely a good support, but don't use it in inappropriate ways. And the best way to know that is to do testing and look at it. Exercise, if a person can do it, absolutely helps support the adrenals. The B vitamins are very important to supporting it. And I like to use a combination, and I'm actually referring more to my mitochondrial deficit here, but it's part of the whole process. I like vitamin B12, folic acid, and there's one that Dr. Wright put together that is wonderful, and it tastes good too. You don't always get a lot of good tasting supplements. And CoQ10. CoQ10 is very helpful at supporting energy on a deep level. Vitamin C is actually the first line of defense in supporting the adrenals, anywhere between 2,000 and 3,000 milligrams per day. But you do want to be careful because it also has an effect on bowels. So too much vitamin C can lead to diarrhea. I would say that's more likely if you're using both vitamin C and magnesium together. But use it carefully because it is actually a good adrenal support. I mentioned the hormones earlier. They do help, especially DHEA and testosterone. Essential fatty acids reduce inflammation and therefore help support the adrenals. Ashwagandha and ginseng, you will find them in different formulas designed for the adrenals. Then you want to consider things like hydrocortisone or supplemental cortisol. And I would say cortisol, and I order it compounded through a compounding pharmacy, so it's bioidentical. And it will help to rest the adrenal gland if the deficiency is really severe. Or let's say you have Addison's disease, which is more of an autoimmune state of low adrenal function. You want to eliminate stressors. I know it's harder to do. I've had people make dietary changes, and especially with reducing things like sugars, carbohydrates, which can take the stress off the adrenal glands. And then I mentioned the vacation, time to rest or recover. It doesn't have to be 3 months at a time. It could be an hour a day where you're actually paying attention to certain lifestyle factors. And I mentioned earlier the mitochondrial dysfunction, the CoQ10, D-ribose, active B12 folate are very helpful in those particular circumstances. Let me first say the adrenals are actually, you have two of them, they're on top of the kidneys, more or less what we would call retroperitoneal in the back. They're small, so thyroid gland also small in the front of the neck. Basically, if anybody has ever palpated your thyroid, they have you swallow, see whether that moves, see if there's anything they can palpate there. It's shaped like a butterfly. There are two lobes with a middle, wraps around the trachea. Sometimes what can happen is if there is a thyroid problem, people will develop a goiter or a growth of tissue. Sometimes, I do have a number of patients that have had thyroid cancer, and they do very well with adding in thyroid hormone. So it basically is what helps you have energy through the day. It helps support the basal metabolic rate of the body. And one of the most overt symptoms of it is fatigue, but there are many other symptoms that occur with it, and some of them overlap with what we would consider other diseases. So these are low thyroid symptoms. It's not exclusive, but low. Constipation, a big one. When people report constipation, I test. High cholesterol is a symptom related to thyroid in many cases. Fatigue, obviously, but joint pain. And many people, both with adrenals and thyroid, are cold. I often, in my office, my most common exam is I look at the nails and I feel the core temperature. And I have so many people that are chilled to the bone, maybe even people in the room that are so cold it penetrates through them to me. That's how cold they are. That's adrenal or thyroid issue. There could be other causes, but that's one symptom that I see. Low immune function, too, with low thyroid. People get sick a lot when their thyroid isn't functioning. I'll just say briefly, there are actually, from what I understand, there are 12 types of thyroid, apparently to a doctor named Dr. Leslie DeGroot. I don't have all of those listed here, but the most common we know of are T4 and T3. The body, we naturally produce T4 and T3. T4 is converted to T3, which is the biologically active thyroid. And that's why we need iodine, because iodine, as it's cleaved off of the iodine molecule, it becomes, goes from T4 to T3, and it's recycled back to create T4. We also have T1 and T2. These aren't known or measured, but they're important because they form these other molecules. So if you have too little thyroid hormone produced, then you're hypothyroid. If too much, you're hyperthyroid. So how do we assess it? I prefer, hands down, blood testing. And then I've had many people come in, and I wanted to be very clear on this test, because there are so many people that don't measure all these things. And I don't know how to evaluate thyroid without doing these things. So TSH, the thyroid-stimulating hormone, is the command from the hypothalamus to the pituitary to the thyroid. So it says, okay, body, we need more thyroid. We don't have enough. So it's sending the signal so that the body responds, produces T4. T4 is converted to T3 out in the body. And so that's all well and good. It's a negative feedback loop. So when you get enough, the TSH stops circulating. But if it's not producing, not acting well, then it'll keep rising. I've seen TSH should be, let's say, in the range of anywhere between 1 and 5. And I'm not giving you the reference ranges we use. We use smaller reference ranges. I've seen them as high as 20. I actually have a patient who has an autoimmune state who's got numbers far in excess of that. So oftentimes when it's that high, we're looking at the autoimmune state. You want to measure the free T4 and the free T3, because that tells us how much T4 and T3 is circulating in the body. The TSH is not enough to tell you that. The reverse T3 is actually the conversion. So normally free T4 converts to T3. When that mechanism is affected by inflammation, by heavy metals, other issues, it goes to what we call reverse T3, which is a mirror image, not biologically active version of T3. So you will see that number rising if that conversion is not working. Thyroid antibodies will tell us whether it's autoimmune, and TSI antibodies are antibody estimate evaluation that tells me about Graves' disease. So it tells us how much your body is producing and how much it's using. And I said earlier, it's not enough just to do a TSH. Conventional treatments tend to be the synthetics. Not to go into or express opinions about them, Synthroid, levothyroxine are the most common ones you've heard of. Synthroid is just T4, so that leaves out T3, T2, T1. In people that, let's say, have a certain need for just that, let's say autoimmune thyroiditis, then that's the way to go. But there was a time about 4 years ago when Armour Thyroid was going to, natural desiccated thyroid, they were going to revise their formula. They've been on the market for 100 years, and they were going to revise after that. FDA made them shut down. We couldn't get, Nature Thyroid, Armour Thyroid. All we could do was either get T3, T4 on ice, shipped to compounding pharmacies, or use the synthetics. During that time, we had so many people that were so sick. They were either underdose, overdose. They felt terrible because people do better on a balance of T4 and T3. I will say, though, there are times you have to use it. Not everybody can do just one thing. So the other way of also supporting the thyroid synthetically is Cytomel or synthetic T3. Here's basically the discussion on using natural thyroid. We found that people feel better on a combination of T4 and T3. It seems to be more effectively converted. The body contains more T4 than T3, and so the natural desiccated thyroids contain a certain effective balance. Important cofactors, I already mentioned iodine. Tyrosine is a precursor to thyroid. Selenium is very helpful in tonifying the thyroid. It's very useful in the autoimmune thyroid state. Vitamin A, zinc and copper and iron, and many people also talk about using vitamin K with it. So let's talk about brain health now. I'm going to refer more to Alzheimer's here, but it doesn't mean it's the only kind of dementia. You can have mild cognitive decline and it's not Alzheimer's. It doesn't necessarily have to progress. You can have other forms of vascular dementia that are occurring. But by 2015, it's really estimated that as many as 1 in 3 or even 1 in 2 people will have Alzheimer's disease. And it's not only is expensive to treat, it's devastating on families and individuals. I'm optimistic, and I'll show you why in a minute. I think we're going to get a handle on it. I think we're beginning to understand it. The other thing to know, too, about some of these problems is that it affects the lifespan. From beginning to death, the average length of time somebody has Alzheimer's is about 12 years. So it effectively reduces the lifespan of somebody. That isn't universal, but as it progresses, people forget even how to eat, and certain other functions stop working as well. Can it be reversed? Now, when I did this talk, or a similar talk, some time back, and I go to the Alzheimer's conventions every year and have done it locally since 2009. Many people were talking about these pathologic changes were irreversible. People are starting to talk about reversibility, and I don't know if you looked in any of the internet feed yesterday or not. They're actually talking about the study I'm going to mention. We've been talking about it here at the clinic for many months. And we even did an article in Dr. Wright's newsletter, Nutrition and Healing, which is no longer available, by the way, some time ago. So there is discussion now, reason for optimism about reversing it. But when we're looking at brain health, this is why I'm saying to people here is you have to be thinking now. You don't want to wait till you're 80. You got to be thinking now about brain health. And even if you're 80, you can still think about improving brain health. There's a wonderful book by a gentleman, Dr. Snowden, who did nuns study. So this was some years back. He decided to study Alzheimer's progression in nuns because it was a captive audience. And he essentially interviewed, cataloged the lives of all the women in this particular order. And it was a longitudinal study, so it went on for many years, and it's still going on, but not with him as the head any longer. And so he definitely showed on autopsy, because that used to be the only way you could identify Alzheimer's disease, that many of the nuns had progressed to Alzheimer's. But did all of them show it? They didn't. There was even one nun that came in at the age of 70, and she actually began an exercise program at age 70 and never showed any mental decline. And when they looked at her brain and they did the autopsy, they had plaques and tangles everywhere. So it shows that these pathologic changes, in some cases, are not directly correlated to symptoms. So that's why I'm very optimistic at what we're seeing, and I think we don't totally understand what's going on. Now, when I say 80 average age of onset, that doesn't include the early onset, the familial types that might come in at about age 40. And so this is what I was talking about, the neurofibrillary tangles, amyloid beta, that have been identified in the brains of people with cognitive decline. There are many proposed reasons for this, but oxidation, inflammation, some of the things we've already been talking about are factors. A study that was done by Dr. Bredesen at UCLA. He and his team pulled together 10 people with varying stages of cognitive decline. There are different stages from subjective, meaning nobody else can say that you're declining, but you feel like you are. You get a lot of people that come in and say, I can't remember anything. You know, if it wasn't for my partner, I wouldn't know where I lived. And so some of that is really not Alzheimer's. Some of it is just the perception of it. But subjective observation is relevant. Some had mild cognitive decline where there are various conditions that are associated with it. One of the first things you see with cognitive decline is people having difficulty with finances, for example. And I'm not talking you can't find your keys in the morning, or you misplace someone's phone number, or you can't remember your friend's name. I'm talking about much more serious things like that that are going on, like you no longer remember your children's names, or you don't know how to wait to go to work anymore, or things like that. So some of the participants in this study were unable to go to work because they had such decline. Some had to stop doing the things they loved to do. There was only one that would have been considered to be late-stage Alzheimer's. Everybody else was between mild decline and Alzheimer's. This is the important thing to know, is each participant wasn't asked to do all 36 things. They were given a choice of what they wanted to do. One case study involved a woman who went on hormones. She elected to, modify her diet, with a diet with healthy whole foods, organic fruits and vegetables, avoiding processed foods, things like that. Wild-caught fish, salmon. And the other thing she chose to do was to fast for 12 hours. So let's say she had dinner at 7. She didn't eat again for another 12 hours. And she didn't eat for 3 hours before going to bed. She managed caloric intake. She managed her numbers, engaged in certain degrees of brain stimulation. This particular woman chose to do yoga and also exercise, and there are recommendations for exercise. And then the study length was between 3 and 6 months. And this is significant. This is the first one to show this. 9 of the 10 people showed improvement in cognitive function. And it wasn't just subjective, it was measured. They did the cognitive testing, they were standardized, and they could show improvement in all but the one patient that had developed late-stage Alzheimer's. It's phenomenal. I mean, this should have set the world on fire, and it's only just now coming out. Probably some of the most incredible information I've ever seen. I'm not surprised, though, because in this building, we've been talking about these things forever. It's now gotten to a place where a study that could be conducted at UCLA and recognized was done and proved that all these things that many of you are already doing are helpful. I didn't write it down, I have an online book produced under the Practicos website, and I wrote it, I began it in 2009, and it was published online in 2012. So, which incorporates a lot of these different ideas. So these were out there already. So I want to say, have hope yourself. I think even hope for the world. So here are some of the successful components. It's interesting. When I looked at it, and I looked at, okay, what can I do right away? Dental care, and not that I was bad at it, I was good at it, but flossing every day. So taking good care of your teeth, flossing daily is one of these things that they recommend. And part of the reason is it prevents bacteria from and inflammation, and it can also prevent heart-related inflammation as well. So good dental care, preventing type 2 diabetes, maintaining blood pressure at a good level. We talked already treating hypothyroidism, adrenals, optimizing weight and diet, reducing stress, getting a good night's sleep. These are things we've been talking about in the holistic community forever. So are they revolutionary? They are, in the sense of there isn't going to be a drug. And at this last conference, everybody said it. No drug is coming to the rescue of Alzheimer's anytime soon. It is not happening. Now, they may be looking at other ways to modify it, but the way to do this is to reduce the insults on the body. Pick up a good exercise program, manage the numbers, stay mentally and physically active. I'm not actually advocating his products, but Gary Small was the keynote speaker, and he was talking about the many different ways of mentally stimulating, from doing crosswords to Sudoku or to testing. I've gone online myself and tried some of these different things, and I'm shocked at how rusty, but then you get going after a while and your reflexes improve. Well, I can't do a crossword puzzle to save my life. It's harder than it looks. So so you all may be whizzes at it, but you know, so he advocates doing a different thing every day to keep your brain stimulated. Not just getting good at one thing. It's not the getting good at it. It's keeping the brain stimulated that is important. And remaining physically active. Supplements. I know you're probably wondering. I will say Dr. Wright did formulate something called Sage Memories that includes lithium, niacinamide, turmeric, rosemary, and sage. And so these are helpful in supporting brain health, but they can also be taken separately. I didn't give you doses because I don't really want everybody to just go put themselves on all these things. There are reasons not to do that too. Lithium, when I'm talking about lithium, I'm not talking about high doses like for bipolar disorder. I'm talking little tiny amounts. But there is good evidence on some of these for resveratrol, fish oils, that's EPA, DHA. I mentioned the pantothenic acid, coconut oil, Magmine, that's the magnesium L-threonate, just a few. And some of them are also mentioned on here. Again, don't spend your mortgage in supplements. You know, so make selected choices. Niacinamide does penetrate the blood-brain barrier, though. So that one does get and is neuroprotective. For me, I was actually on a very low dose of lithium, like 5 milligrams, when I had my stroke. And I think that's partly why I was protected neurologically. I still have deficits that affected the right side, but I think I bounced back much more quickly. And the neurologist I worked with, it was almost like he had to whisper it to me. He said, I would give lithium to more people myself if I could get away with it, if my colleagues didn't object to it. Anyway, so he recognized neuroprotective again and neuroregenerative. That's why I like also B12. It has a neuroregenerative component to it also. So there are things to do that are supportive when we're talking about a good brain health program. And so kind of what I'm talking about is how to pay attention to your symptoms, optimize, improve your health for healthy living and brain function. I did mention food allergies, stimulating the mind, get a good routine, eliminating body burden. I'm talking there about heavy metals, which we didn't go into much. We didn't talk digestion either, but you know, I believe in the knee bones connected to the thigh bone. The digestion is the key to everything. So you could take 100 supplements, but if you can't digest them, then you just have expensive urine, right? Thank you all.